Good morning, everyone. It is 9 a.m. and we're going to get started in another couple minutes. I can see we have people joining us still, so stay tuned. Okay, we are going to get started. Welcome to the Western New York Women's Foundation Pathways to Progress Speaker Series webinar on building resilience. I am Corey Fabian Barrett, Director of External Affairs at the Western New York Women's Foundation, and I'm joined on the webinar this morning by today's speakers, Ashley Amidon and Megan Moore from Crisis Services, as well as Mary Rossi, our Strategic Initiatives Coordinator, who will be helping out behind the scenes. Thank you all for joining us today. Before we get started, a quick word about the Western New York Women's Foundation and the work we've been doing lately. Our organization exists to support the women and girls of our community, a mission which has become even more critical in recent months. During these strange times, we've seen how a pandemic of this scale especially impacts and disrupts the lives of women in our communities. Recent reporting has shown that 64% of frontline workers are women. That's 9 out of 10 nurses, 2 out of 3 grocery store clerks, and 85% of childcare and social workers. So we here at the Western New York Women's Foundation have been working overtime to advocate for these women in recent weeks. We've been pushing for paid sick leave and for affordable and accessible childcare for essential workers with our partners at the Child Care Resource Network and Workforce Development Institute. And I'm happy to report that we've had some really good wins lately. We recently helped connect childcare providers with supplies like thermometers and face masks that they needed to keep their doors open. And with the support of childcare champion Senator Kennedy, we secured $500,000 in childcare subsidies for Erie County. Advocacy works. The gendered experience of coronavirus is based in the gender inequalities that impact all of us every single day. This crisis is only making those disparities more visible. That's why we're actively continuing our work to advocate for women's economic empowerment, paid sick leave, and affordable, accessible childcare for all. So thank you for taking the time to join this webinar today. We know your time is precious, and we really appreciate your support of our work. We will continue creating these spaces for women to convene and learn in the coming weeks and months, so stay tuned for upcoming offerings from the Western New York Women's Foundation. And now I have a few housekeeping notes for today's webinar in particular. We will be online talking with you all for about an hour today with time for questions at the end of the formal presentation. This full session is also being recorded and will be freely available online afterwards if you want to watch it again or share it with a friend. In your webinar sidebar, you will see that there is a handout section which provides downloadable takeaways from today's presentation provided by our friends at Crisis Services. Also in your sidebar, just below the handouts, you will see that there is a chat box. We will be pausing for questions throughout the presentation and at the very end of today's webinar. So if you have a question or want to share an experience that you've had, please just type it into the chat box at any time. Mary will be monitoring all throughout. You'll see where you can select send question to staff, and that will make sure that we see it. And now I'll take a minute to introduce our two wonderful speakers for today, Ashley and Megan. Ashley Amidon is a supervisor at Crisis Services, where she focuses on providing administrative oversight to the Advocate Department's case management and hotline teams. She also works to foster collaborative relationships with other community partners, including oversight of the department's co-located projects with Erie County law enforcement. She began her career in 2008, working as a sexual assault caseworker in Niagara County and providing direct services to survivors of sexual violence. In 2012, she joined the Crisis Services team, becoming the sexual assault case manager for Erie County. Since then, she has held many roles within the agency. Ashley holds a bachelor's in social work from Buffalo State College and is currently completing her master's in social work at the University of Buffalo. Megan Moore is also a supervisor at Crisis Services, whose focal areas include providing administrative oversight to the Advocate Department's prevention, education, and community collaboration efforts. Megan began working in the field of sexual and gender-based violence in post-conflict zones with a non-governmental organization. She holds 2 graduate degrees, a Master's of Science with Distinction in International Conflict and Cooperation from the University of Stirling, and a Master's in Politics from the University of Edinburgh. Since moving back home to Western New York, Megan has held multiple roles at Crisis Services while consistently serving as the resident data nerd and research enthusiast. 3 cheers for that. Thank you both for being with us today. We're going to take it away, and I will hand the presentation role over to you, Megan.
All right, good morning, everyone. This is actually Ashley talking. Megan's going to control our PowerPoint for us. So thank you so much for joining us this morning, and I want to thank the Western New York Women's Foundation for having us and hosting this very important webinar. And I'd also like to thank Corey for those wonderful introductions. So my name is Ashley Amidon, and I'm here today with my colleague Megan Moore. We're both supervising counselors within the Crisis Services Advocate Department. And if you don't know what that is, we're Erie County's designated rape crisis center and a non-residential domestic violence service provider. So today we're going to talk to you about a topic that is often discussed within the helping professions. However, now it's relevant to everyone due to the fact that we are living in a global pandemic. COVID-19 represents an unprecedented pandemic that is testing our collective capacity to cope. As the boundaries between our personal and professional lives blur, we are being forced to adapt our strategies to cope in order to maintain our emotional safety and well-being. Today, we're going to talk about COVID-19 as a trauma and what that means. We're going to talk about the phases of vicarious trauma, including compassion fatigue and burnout. We're going to talk about the warning signs to be aware of and acknowledge that might be indicating you are reaching the point of burnout. And finally, we're going to talk about how to build resilience through emotional intelligence in an effort to prevent you from reaching that space of burnout. So in order to talk about trauma, we need to define it. So trauma is a psychological and emotional response to an event or an experience that is deeply distressing or disturbing. Megan and I are actually experts in trauma. Prior to becoming supervisors in our department, we were both case managers. That means that we've been on the front lines of working directly alongside survivors of interpersonal violence, and often the worst day of their lives.
Ashley, I'm just going to jump in. I think we're having some issues with your microphone.
Oh no, okay.
You're kind of coming in and out. Are you moving your head maybe?
Can you hear me now?
Yes, that sounds great if you stay there.
Staying right there. I'm so sorry, folks. Okay, so as I said, Megan and I, we have worked on the front lines of interpersonal violence as case managers. And now we supervise those on the front lines, working to support them through the difficult work that we do. However, we know this work and we know this kind of trauma and we know how to process it and get through it. However, now in the face of a global pandemic, our worlds have drastically changed within a very condensed time period. This is something we weren't prepared for and isn't something that we were necessarily trained for. Although maybe Megan, she's worked in a lot of conflict zones. And as we're going through these motions and changes as an agency, we are also going through them and experiencing it as individuals. And we're experiencing it with our family and friends and witnessing our community experience it. So on April 22nd, Governor Andrew Cuomo was on The Daily Show with Trevor Noah. In talking to Trevor, he acknowledged, this is traumatic. This is PTSD for an entire generation that will talk about this. And it is personal. So I tried to communicate how I feel personally and my fear and my anxiety. As part of this, to say to you You are not alone. Everyone is feeling this, and I'm feeling it too. And as I said earlier, within a very condensed and shortened time period, our lives and worlds changed drastically. We went from the normalcy of everyday life, being able to go to work, our children were attending school, we were able to see our friends and our family as we wanted to at our leisure. We were able to take a trip to the grocery store to grab that one ingredient that was missing from a recipe. To within a week's time, due to occupancy limits, many of us are working from home, or if we work still in our offices, it looks drastically different. Some of us have been furloughed and laid off. Schools are closed and children are being homeschooled. And for some, they might know an essential worker or are an essential worker, and there is a level of anxiety that now exists in interfacing with the public for fear of contracting a rapidly spreading and very contagious disease. Our social interactions are limited to Zoom and phone calls. It's a really tough time. Our lives have been turned upside down. So at this time, I'm going to pause very quickly. Mary, do we have any questions coming in so far?
Not yet, but I'm sure we'll have some soon.
All right. So moving on. On March 22nd, per the New York State on Pause executive order, all non-essential businesses closed. And for businesses that are open, there are occupancy orders that were put in place, decreasing the amount of folks that you can have in a building, and gatherings ceased. This moment was the catalyst where many of us began to no longer have the divide between our personal and our professional lives. Our lives changed significantly. And as we are going through these motions of these changes, some of what we might be experiencing might actually be grief. We might be grieving a loss of normalcy, a loss of connection, a loss of time dedicated to caring for ourselves, an impact on professional growth and development. Perhaps we were headed in one way at work and maybe now things look different. There are economic tolls, cancellation of major life events or milestones. And the reality is, as women are often caregivers, not just for their children, but for many in their lives. So we're not just processing this for ourselves, but we're also helping others process it. And the reality is that many of us are experiencing the same things, but because we are isolated to our homes and maybe just going to work, we can feel very alone in this. But the reality is, we are experiencing this collectively, and it's a collective trauma. So I want to pause now for our participants, and I'd like you to take a moment to reflect on where you're at right now and how you're experiencing this. Corey's going to put a poll on the screen, and we're really interested to what you're feeling most right now. So I'm going to give you guys a moment, our participants a moment to participate in this. You can choose more than one, but we'd like to know, where are you at right now? What's going on for you? How are you feeling? I'm going to give you all a moment to participate.
Can everyone see the poll? Raise your hand, I guess. There we go. Some people putting in their votes.
All right, let me know when we are ready, Corey.
Yeah, I'm going to give a few more seconds. People are still voting. Having a lot of feelings.
I think we all are right now.
Yeah. All right, I'm going to go ahead and close the poll. If you get your final answers in, click submit. Okay, and so I'm just going to read off, I guess. Oh, actually, let's show the results. There we go.
All right. So most folks are feeling a loss of normalcy, and I really think that we're all feeling that impact. I know I'm missing being able to get up and go to work every day, because right now at Crisis Services we're on a rotation. isolation and or missing time for self. So we've got 42% of folks feeling that. We've got some folks feeling an economic impact. Other folks are feeling the emotional toll that I've been talking about of having to care for others. And then we have a few folks that are actually feeling okay and in their element, and that's okay too. But as you can see, and if we can move back to our PowerPoints.
There you go.
From the results, many of us are having similar experiences. So now this is going to bring me to talk to you about the phases of vicarious trauma. So what is vicarious trauma? It is an emotional impact of being exposed to others' trauma. As we've discussed, this is something we're experiencing collectively. And as we're experiencing our own individual reactions and emotions, we're also exposed to the impact that this is having on others. We may be seeing our children struggle as they miss their friends and they miss school. We are seeing our friends and family impacted. Perhaps they're a frontline worker and they're experiencing exhaustion. Or the opposite, perhaps they have lost employment and stable income. And because of the news and social media, our level of exposure and consumption of the impact that this is having on our community, the nation, and the world is ever present. Which brings me to talk to you about compassion fatigue. So what is it? It's a diminished ability to empathize or feel compassion for others. As we are not only trying to take care of ourselves, but also trying to take care of others, this can take an emotional toll on us. We might feel our patience wearing thin, our ability to express empathy feeling limited, and the space we usually have to hold for others filling up. And if you're experiencing this can be a sign that you might be experiencing or getting close to burnout. So let's talk about what is burnout. Burnout is a state of emotional, physical, and mental exhaustion. This is a difficult and heavy space to be in. We want so much to be able to hold that space for others, but it can be difficult when we ourselves are experiencing all of the things that we've been discussing this morning. Our loss of normalcy, our loss of connection, and the overall emotional toll of living through and experiencing a global pandemic. It's uprooted our lives in a significant way, which can certainly lead some of us to get to the point of burnout. However, there are warning signs that we might be reaching the point of burnout. And so let's talk through these. What do these look like? So some of the cognitive signs might be confusion, lack of focus or recall, difficulty problem solving, misinterpretation of comments. I know for myself particularly, difficulty problem solving has been something that I've been dealing with as of recently. 8 weeks ago, a question that I could have critically worked through and problem solve with one of my staff or one of my colleagues is taking me a little bit more time right now. Then there's the behavioral. There's the risk-taking, having conflict with others, social withdrawal and self-isolation, and the reduced ability to support others. And that's what I'm talking about in when we don't have a lot of space to hold for others because that's filling up with all of this other stuff that we're dealing with. And then there are the emotional warning signs: intense sadness, anger and irritability, increased fear and anxiety, difficult maintaining emotional balance. I know for me this week, again, the difficulty maintaining emotional balance is something that I've noticed I'm experiencing. Either I'm extremely emotional or I might not be feeling anything at all. And so, Megan's going to talk to you a little bit later about how we work through that. And I've done some of that work this week. But it can be a really, really tough space to be in. And then there's the physical: headaches, muscle tension, trouble sleeping, increased heart rate, inability to relax and decompress. And so you might not be experiencing all of these things. You might just be experiencing them in one area. But it's important to note that if you experience these symptoms and they last longer than 2 to 4 weeks or interfere with your relationships, work, or daily functioning, that you might need to seek care through a mental health professional. And later on, again, we're going to provide some resources for that. However, it is our hope that by today, and equipping you with this knowledge about the warning signs, and soon some knowledge about building resiliency, that you won't get to this point. We really want to prevent this from happening. And recently, someone in mine and Megan's life was noticing some of these signs. Megan and I are really lucky to have a supervisor that really models how to care for yourself, which we also try to do for the staff that we directly supervise. And this supervisor is usually very level-headed. She's an excellent problem solver and critical thinker, and she always has space to hold for her team. However, a few weeks ago, she started to notice that she was experiencing some of the signs that I just went through. She was feeling more irritable. Questions that would normally be asked of her were starting to agitate her. And she was feeling short with others and realized that she had less space to hold for our team, which in crisis work and the work that we do, that space is really critical. And so because she has a strong level of self-awareness, she noticed this immediately and employed a tactic to care for herself and to help her get into a better space. And again, Meg's going to talk you through some of that as we move through this presentation this morning. But what she did was she started taking some time away from work each week, just a couple of hours, working a half day, and then spending the rest of the day focusing on herself and her family. And what's important for everyone to know is that sometimes we need space away. And sometimes we need time for ourselves. And that's really okay. And so I'm going to pause for a minute. We've covered a lot of content on what trauma is, how we might be experiencing that, what the phases of vicarious trauma are, and how to note whether or not you're getting to that space. So Mary, do we have any questions that have come in yet?
We don't have any yet. If anyone does have any questions, feel free to put them in our little chat box or in the question box, and we are more than happy to share them.
Great, thanks, Mary. So now I'm going to turn the presentation over to my colleague, Megan. And she is going to talk to you about how to build resiliency through emotional intelligence. So Megan, you want to take it away?
Absolutely. Thanks, Ash. And if I could just add really quickly, I know Corey and Mary discussed this in the beginning, but just so you all are aware, if any of those warning signs really kind of resonated with any of you, one of the worksheets or one of the handouts that is provided is actually a self-test that you can either take for yourself or share with others to kind of go through and really assess where you're at within those phases of vicarious trauma and potentially approaching burnout. Okay, so Ashley has done a really great job at really contextualizing and articulating how experiencing a collective trauma can cause a stress reaction that manifests differently for each of us. And while I won't deep dive into the neurobiology of trauma here today, I do want to say that traumatic stress triggers an emergency response in the amygdala, which is the center of our emotions. So being able to process our emotions is really imperative. And today I'm going to talk to you a bit about emotional intelligence, which Shrivastava defines as the ability to monitor one's own and other people's emotions, to discriminate between different emotions and label them appropriately, and to use emotional information to guide thinking and behavior. So I like this definition because it really conveys emotional intelligence, or EQ, as a process through which you identify and meaningfully engage with your emotions, which in theory sounds great, doesn't it? In practice, though, think of all the times that we're asked how we're doing or feeling. And out of politeness, we have been socialized to respond succinctly with something like, fine, and you? Or a favorite in our office is just a simple living the dream with like a thumbs up. And while all of that seems innocuous enough, the reality is that these responses are often deflections that are caused by our lack of knowledge or comfort in truly understanding what it is that we're feeling at any given moment. As a society and a culture, we haven't really fostered our emotional intelligence, though we're starting to see this shift with the introduction of social emotional learning standards in schools across the state, which is incredible. I'm so grateful that my 5-year-old niece was sent home with a mood chart to really sort of help her understand what she's feeling and why. But it dawned on me that this means like we, as in older generations, have some catching up to do. For example, we were at Letchworth State Park last year for they have an annual fall craft festival, and I entered the park in just one of the side streets, and I got caught in traffic, and we're bumper to bumper, and people keep stepping out in front of the car, and my anxiety is just at an all-time high, and so I let out a really heavy breath, and I was like, "Oh, are you kidding me?" And here's this 5-year-old in my back seat, and she just says, "Maggie, you sound upset. Why don't we take a breath?" And I'm just staring at her in the rearview mirror, and I'm like, this kid has a better grasp on her emotional regulation than I do. And it really just sort of dawned on me that we really have to work on that. And I know one of the other handouts we shared is Mark Brackett's mood meter, which is really a more sophisticated adult version of a mood chart to really sort of help us understand and navigate emotional intelligence. My screen doesn't want to click. There we go. Okay. So understanding emotional intelligence. From the onset, I think it's important to conceptualize emotional intelligence as both an intra and interpersonal process. Our emotions may be processed internally, but they're expressed externally through our behaviors, right? Like no one wants to be told you're killing my vibe right now because you can't seem to get it together. So today we're going to focus on 5 key skills to building our emotional intelligence. So first is self-awareness, which is the ability to pause and recognize your emotions and to assess your limits. So this is really about taking the time for critical self-reflection and checking in with yourself honestly. Second is self-regulation, which is the ability to manage your emotions and practice adaptive engagement, which is really just being flexible to changing circumstances by focusing on what you can control. So naming and processing through your emotions in a healthy and constructive manner while challenging your internal dialogue, which we'll get to more in just a minute. Third is empathy, which is basically step 1, but in the context of providing this insight into others. So having the ability to identify and understand emotions in others, meaning objectively taking a step back to assess the feelings behind their actions or behaviors. And fourth is motivation. So this is what keeps you going and what drives you or refuels you. To steal a quote from Marie Kondo, what kind of sparks joy? So this is really about taking care of yourself in meaningful ways and integrating self-care strategies into your daily routine. Again, more of which we'll get to in a minute. But last is social skills. So this is the ability to understand how our emotions and behaviors affect those around us and how we can manage our relationships accordingly. So all of these things kind of combine and are essential to building our resilience. So I'm just going to pause because I know I tend to talk a little bit quickly. So Mary, were there any questions that sort of came up on that before we move on?
One question that we did have was how to deal with our kind of guilt around being in a safe space and having basic needs met, and kind of working through that and dealing with your own trauma and grief while still being safe and having basic needs met.
Absolutely. That's such a great question, such a great point, and something that I think, really we're going to touch on in just a minute in terms of resilience and how to balance that, right? Because one of the things, I definitely appreciate is the context of, we have our own individual needs and our individual process for coping through this time, but I think it's also important to reflect on the collective. So I'm going to touch on that in just a moment. So we've been throwing the word resilience around, and I feel as a preventionist, it's important to acknowledge why we're focusing on resilience enhancing behaviors as a means of preventing burnout. And to that end, when we talk about resilience, we're referring to the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. So we've established that COVID presents a unique set of circumstances through which we're grieving our loss of normalcy, routine, and connectedness. this virus really challenges our very nature as social creatures of habit. And yet, if we look back throughout history, human resiliency really sort of stands out amongst the darkness that comes with all great disasters or times of hardship. And I included this definition because it raises two great points. Firstly, is that this too is a process, meaning as much as we would all love to wake up in the morning with a developed sense of resiliency, it's actually something that we have to work at and to model for our families, colleagues, and beyond. And secondly, is that it's described as adapting well, as in to the best of our ability, which is relative to not only the effort that we put into it, but also to our privilege. So I had read this analogy somewhere that while we're all in the same sea right now, we're in very different boats. And I think it's so important to recognize that this pandemic is exacerbating pre-existing inequalities in our community. And really sort of grapple with what that means for practicing gratitude while also holding space with compassion for others. And I think this really sort of touches on that question that just came through on, now is the time that we have to really sort of sit with ourselves and ask how we can adapt, as well as what good, can we bring out of this, tragic and challenging time. Okay, so before I get on my soapbox, because you didn't tune in this morning to hear me rant about intersectionality, when really the main takeaway that we want you to have is around resiliency techniques. So what does all of this actually look like in practice then? I'm so glad that you asked. We're going to go through 5 key techniques that you'll notice actually mirror the 5 components of emotional intelligence. And I actually like to refer to these more as steps, if you will, because I think there's a tendency for us to skip right into the self-care components without truly assessing why we need it to begin with. So really the question is, how do you know, what you need? How do you know when you've hit your limit before it's too late? And I think, Ashley has done a really great job at kind of hinting at what a supportive work environment we have, and we're very fortunate for that. I mean, self-care is something that we actually start asking folks about in the interview process. What do you do to take care of yourself? And while I think that's a fantastic step, one of the things that I've come to recognize is that it also puts the responsibility back onto that person, right? To be able to identify, how you're feeling and then therefore what you need to sort of work through that. And this is very much become somewhat of a personal crusade for myself. Because respectfully, I believe that everyone on this call is, capable and dedicated. And for that reason alone, I think oftentimes we almost need permission to give ourselves this space, right? I often provide the example when I'm talking to our team about emotional intelligence of when I started with the advocate department, and I was actually the domestic violence case manager co-located at the Erie County Sheriff's Office. And I was responsible for responding to domestic violence cases throughout all of the South towns, which was deeply personal for me because I was born and raised here. And so a lot of the folks who I was working with, I identified very strongly with, they were a few different life choices away from being me. And so I threw myself into the work. I threw myself into making myself available to them. And not only that, in my personal life, I was, being a caregiver to my niece. I was smack dab in the middle of negotiating my parents' divorce. And very soon I realized, I wasn't practicing healthy boundaries in any aspect of my life, but rather than grappling with it, I had resolved myself, I'm a strong, independent woman, so I'm going to continue to show up for people. And I did, until the point where I couldn't show up for myself. And that's really the stage where I found myself on our director, Caitlin's office floor, needing to be taken to the hospital for a migraine that was so bad, they actually thought it could be an aneurysm, which also happened to coincide like 3 days before my wedding. So I really wasn't in a good space because I wasn't being real with myself about how I was feeling or about the impact that not only the work, but the professional, not only the work, but all the personal components of my life, was having on me, because I didn't want anybody to think that I couldn't handle myself. or I didn't know how to articulate my thoughts or my feelings or my concerns without making it seem like I was complaining, right? Because of course I was going to show up for my niece, of course I was going to be there for my family, of course I was going to show up for my clients, I was going to do and be all of the things. And I think we all have that capability within ourselves. We also have to be able to sit with ourselves and be realistic about what that impact is and what we need to sustain ourselves through that process. So really, we're going to go through kind of these step by step. So step one is about identifying and processing your feelings. So appreciate that you will feel a variety of emotions throughout this time, ranging from anxiety, happiness, anger, depression, and recognize that all of this is normal. This is a normal response to a completely abnormal situation. And this is really about our self-awareness skill, right? So naming the emotion as we feel it, giving ourselves space to feel it and to process through. And this is where tools like the mood meter can come in handy to really help you navigate what you may be feeling. There's power in labeling things. It's how we acknowledge and start to process through while respecting our limits and allowing ourselves to articulate our needs, right? So step two is about tracing behaviors to thoughts and feelings. So we've established that your emotions impact you and those around you, which means our self-awareness has to include some assessment of how our emotions, thoughts, and feelings influence our behavior and how that behavior is perceived by ourselves and others. So if you think about it, our reputations are really reflections of how others perceive us based on observable behaviors driven by internal emotions. So the question is, what kind of supervisor, partner, or parent do you want to be? For me, I really strive to be present and supportive in all of those roles. So at work, that usually looks like a literal open door and consistent accessibility. And then last week, I noticed I was getting short with my team, rushing my responses because I felt pressed for time. And one of my staff messaged me after a group meeting to check in because she really felt like I wasn't myself. So I had to step back and sort of trace the observable behavior, right? So being short, not fully engaging in the conversation, had to trace that back to my feeling of being overwhelmed. Well, why was I feeling overwhelmed? I'm overwhelmed because I feel, unorganized and I have a lot to do. Okay, so what's on my to-do list? Normally this is written out at the office on Monday mornings, but I don't go to the office on Monday mornings anymore. So let me write it down now. And then after I wrote everything out, I realized that of the 11 things I had in my head as pressing items, only 2 of them actually had hard or time-sensitive deadlines. The rest I had self-imposed a sense of urgency on because I was overcompensating for all the things I can't control right now by focusing on my productivity, which really led me to try my hand at step 3. So step 3 is about practicing cognitive reframing, which is really just, a fancy way of saying to challenge your internal dialogue by seeking to balance your thoughts and feelings. Sometimes this can be referred to as positive self-talk or positive reframing, but I believe that positivity not anchored in the reality of our circumstances is actually just denial. So I would rather we seek balance or find another way to present the negative. So for example, feeling rushed and back-to-back Zoom meetings, which I'm sure all of us can kind of relate to lately. I used to start on by, feeling flustered and saying, okay, sorry I'm late, guys, let's get started. And really, I realized I was actually projecting a negative perception of that behavior onto the group. And so because I was starting and presenting in this space rushed, odds are they were feeling the effects of that as well. So I really sort of tried to look at that differently and find a more balanced or nuanced approach to those situations. So now if I'm running a couple minutes behind, I'll usually send somebody a heads up. And then when I log in, I just acknowledge and say, thank you for waiting for me, because that reinforces the positive behavior and the positive aspects of the interaction and, doesn't actually linger on any of the negative. So thinking about what that means, to have a more balanced approach, right? Which is actually a nice segue into step 4, which is to practice regular and ongoing self-care. I'm going to go ahead and call this that this is actually going to be the hardest step, because as a collective, us female identified folks aren't great at self-prioritization. If we were, beauty companies wouldn't profit off of obvious slogans like, because you're worth it. Yes, thank you, we know. But also, I think that many of us are still really trying to figure out what we need. So going back to the motivation skill set, what is it that sustains and replenishes me? This is going to look a lot different for each and every one of us. And this is the corresponding outlet to our emotions. For some, it's intellectual, and they'll throw themselves into books or into learning a different language. Que magnifico. For others, it will be busy work. I myself am a tinkerer, and if there's one silver lining to buying an old farmhouse, it's that there's no shortage of home improvement projects that need, my attention. So, yay, adulthood. But overall, it's important to try different things to determine what it is that allows you to take meaningful and dedicated time for yourself to recharge. And I'd be really curious, to kind of pause and see if folks feel comfortable sharing in the group chat. What are the things that you found that really work for you? What are the things that you do to take care of yourself that, you have found really meaningful during this time? So Mary, I'm just going to give just a second to see if folks feel like sharing, and if not, we can kind of move forward.
Okay. All right, we have a couple of answers coming in,
Okay.
including working out has been helpful, meditating, yoga, allowing, cooking, pampering yourself, and allowing grief and joy to coexist.
Absolutely. I love that. Allowing grief and joy to coexist. So carving out space. So that's all about that balance, right? We know that we're going to feel the negatives. We know that we're going to hit those emotional ruts, and trying to focus on the things that are going to pull us out of that and really going to sustain us through. That's fantastic. Thank you all for sharing. And for those of you who maybe, haven't really found that thing that's kind of for you, my challenge to you all is to really think about one thing, just one thing that you can do for yourself that would have a positive impact on your emotional state, and to find a way to integrate that into your daily routine. Now, that can be as simple as, protecting 5 minutes for yourself in the morning for a cup of coffee, or, setting a time limit on your daily media exposure, or, it can be as complex as establishing a weekly workout routine if you're that way inclined, or carving out time to binge watch an entire series on Netflix. Whatever you choose, I just hope that we're all patient and forgiving with ourselves, just as we are with others, which really sort of rounds us out to step 5, which is to foster open and empathetic communication, which is equally about trust as it is about accountability. So, who are the supports in your life who you trust with responding to the "how are you" prompts honestly, and how can we be that support for others? Really, for me, this boils down to leading by example, right? And by listening to be present rather than listening to respond. And if I don't have that space to do that, to communicate that openly. Ashley provided this example of in our workspace where folks are used to just popping their heads in our door to say, here's this thing that I need, or to just run something by you, or just kind of to chat. And we've gotten into this practice of sort of starting into that space with, hey, do you have a second to chat about this? Because it gives that person the out, right? To say, to really sort of assess their boundaries or their limits, to say, what, actually, I really don't have the brain space to grapple with this grapple this over this with you right now, but can I come and find you in a little bit after I finish this report, or after I send a couple emails, or whatever the case may be? Because that's also acknowledging the fact, like, I want to give you my full attention, you deserve my full attention, and respecting your boundary at that moment. So to say, that I hear you, I see you, and I want to help, it just maybe can't happen this second. I think it's really important that our teams and our loved ones see and understand that we're human too, and that we're all working through this in our own way. Okay. I think my computer keeps falling asleep. So after throwing all of that at you, I'd really just kind of like to offer a summary of the key points in case you're like, Megan, you seem lovely and this all seems totally relevant, but I haven't retained any of it because I was checking emails and letting the dogs out and resolving a crisis in which my kid lost Mr. Dinosaur's walking shoes. To which I would say you've absolutely nailed the open communication technique. You're a hero and I've got you covered. So if you take nothing else away, I hope that you will remember this. Building resilience can really be broken down into an ABC approach, right? A is for awareness. So this is our emotional intelligence, practicing self-awareness to better understand our needs and to act accordingly to meet those needs. B is for balance. So bringing balance to our thoughts, feelings, and actions. Building resilience is a balancing act between action and mindfulness. This balance guides our decisions about embracing or relinquishing certain activities, behaviors, or attitudes. It informs how we give attention to the physical, emotional, psychological, and social aspects of who we are. And lastly, C is for connections. So resilience doesn't take place solely within ourselves. It involves being connected in meaningful ways to others and to something larger. We really grow and thrive through our connections that occur in our friendships, our family, social groups, in nature, in recreational activities, and in many other ways. So during this period of social isolation, we have to lean into one another and ourselves to find strength. And this is really one of those, I don't know who needs to hear this, but inclusions to really cut yourself some slack. You're likely doing a lot better than you think. I know this is something that I've had to read regularly as part of challenging my internal dialogue, which sometimes can get pretty negative. But it's overall important to remember that there's no singular formula for building resiliency. There's no right way to get through this. And the best we can all do is to focus on what's within our control and to work to let go of the things that aren't. I continue to sit with myself during this time and try to be present for those around me in an effort to commit wholeheartedly to the view that together we will see this through. And a lot of that looks like sitting with myself, identifying where I'm at, what is it that I need, and also how can I give back? Because I recognize that, while this is an uncertain time for me, this is uncertainty that I haven't experienced previously, while others, in my community, especially out here in the South Towns, are, this is something that they regularly interface with. They don't always have economic security through, stable work, or they don't always have access to basic, necessities. So part of some of the things that I've been focusing on are what are the ways, even if it seems small, what are the ways that I can give back and really find value in that? One of the local farm stands, for example, is actually set up as kind of a self-help pantry. So every week, when we do our grocery run, or every 2 weeks, we collect a couple extra items like basic necessities, whether that's, canned goods or diapers or formula mix or anything like that. And we drop it off at that local stand. And there's so many efforts that are kind of growing around that really, I think, sort of bolster that silver lining, right? So that's human resiliency showing through. That's demonstrating that, we're all in this together, and there are things that we can do to sort of lift one another up to remind us that we're not alone at this time, even though we may be separated. And as always, we like to end with different resources. So if you or someone you care about is exhibiting signs of burnout, or really just need a space to talk, please, please, please reach out. There's always someone that's available to listen. We provided our 24-hour hotline number. New York State Office of Mental Health has also opened up a dedicated emotional support helpline. There's a crisis text line, and the Substance Abuse and Mental Health Services Administration always has a disaster distress helpline that's specifically dedicated to talking folks through some of their anxieties related to this pandemic, or any other type of disaster or crisis. So I'm just going to leave that up for just a second for folks who are interested. And again, this is going to be recorded, so if you need any of those, please utilize them. But I just wanted to say thank you again to you all for joining us on this Friday morning, and to Corey and Mary for having us, and for all of your advocacy efforts, on behalf of women and girls across Western New York. It's truly incredible to see, what we're capable of in these times. So thank you again. This has been wonderful, and we're happy to take any remaining questions that folks may have.
So we've been receiving a lot of thanks. I've been kind of bombarded with several thank yous directed toward both you and Ashley. So thank you both for this incredible presentation. Someone wanted to comment. Oh, there's so many questions coming in. That they find that taking a walk and doing mindfulness breathing has been helpful. Oh, and someone has said that they loved the resiliency techniques, and they're finding that screen fatigue has been very difficult. And do you have any particular recommendations for disconnecting from the screen or other forms of technology?
Absolutely. So this is a boundary that I have had to draw in both professional and personal life. So before I had briefly sort of touched on, sort of putting a cap or a time limit on social media exposure. And for me, that looks like normally I follow a lot of different news sources. I've kind of hid those for right now. The content area that we particularly work in is usually heavy enough. So for them to be constantly bombarded by different updates and things like that, I've had to be very strategic with, kind of the updates that I have. So I've hit a lot of the news feeds, and then I only give myself kind of an hour a day on social media. I'm sure everybody can relate to this, but I didn't realize so many people that I went to high school with are now like professionals in public health. So it's been really challenging to try and protect kind of my mental health in that space. So I really, again, for me, it goes back to balance. So what are the sources that I think I find positive inspiration from? And if so, really sort of dedicating my focus to those sources, or limiting and putting a cap on that. And the same applies in the work context. So I always open up a bit of a variance to my team to say, we have a meeting scheduled for today. Can that happen over the phone, or is it meaningful for us to have, a virtual face-to-face to really sort of meet everybody where they're at? Because I definitely get screen fatigue, and I need to change it up. Some days I will let folks know that I'm around and available on my cell, but that I'm working on like actual paper. I'm sorry for any environmentalists. Sometimes I'm a very like tactile learner, so I have one day at the office and I'll print stuff out because it's just a different medium to really sort of sit with. So if it's articles, or, if I'm reviewing content for some of the team, really sort of varying the modality of the work, I think is important. And, on a personal level, definitely trying to monitor, like, what are the sources that you go to, and are they reliable? One of the things that I've switched to, rather than 17 different news media outlets, is I actually just signed up for Governor Cuomo's daily coronavirus updates, like the email updates that come through, because it's usually only like 5 bullet points, and it always ends with kind of like an uplifting, highlight, if you will. So that's been really helpful for me personally, but definitely I know we live in a digital era. That doesn't mean that we have to be constantly accessible on all platforms. So yeah, just be mindful of that, and find the platforms that are really engaging or meaningful and have a positive impact on you. I hope that answers the question.
Thank you so much. And there's many more thank yous coming in. I did, because there've been a couple of questions, want to add that this recording will be available on our website under Events Pathways to Progress Speaker Series. And just many more thank yous coming in. So I'm going to turn it back over to Megan or Corey, whoever wants to take over.
Thank you, Mary. Yeah, thank you, I think, to Ashley and Megan for this fantastic session. You've given us so many things to think about and so many great tools that we can use in our daily lives. So I really appreciate both of your time and putting together this great presentation for us. Anyone who has attended or registered for this will get a link in a couple hours to the video recording, so it'll be really easy for you to find and reference all of this if you'd like to. It is a free recording for later. Also, a quick reminder, if you found this helpful, please follow the Western New York Women's Foundation and Crisis Services on social media. So you can see on the screen we're pretty much everywhere. Limit your time, but do follow us. Our next webinar will be on Friday, May 29th at 9 a.m. We'll be joined by Jenna Wachowski of the Buffalo Psychiatric Center in a sort of follow-up to the topic we talked about today. She's going to be talking about practical tips for managing anxiety specifically and also feeling more resilient in times of crisis. There's more information about this session as well as past sessions on our website, wnywomensfoundation.org. And again, our very special thank you to Ashley, to Megan, and to Mary. You made it all go so smoothly today. And thanks to everyone for joining the webinar. I hope everyone can be safe and be well.